All right, today we're going to pull back the curtain on something that pretty much all of us have been through but maybe don't really get. The basic physical assessment a nurse gives you.
You know the scene, right? You're sitting there on that crinkly paper on the exam table while the nurse does their thing. But have you ever actually wondered what they're really looking for with all that listening and tapping and just observing? Well, we're about to dive in and find out.
Okay, so let's get right to it. What even is a physical assessment? It's way more than just a routine checkup. You should really think of it as a super systematic investigation. It's how a nurse gets a really precise snapshot of your health, right at that very moment.
So why is this a big deal? Well, because this whole assessment, it's basically the foundation for all patient care. It helps establish your personal health baseline. You know, what's normal for you. That way, if something changes, it really stands out. It's how nurses can spot potential problems, sometimes even before you feel any symptoms. And of course, it lets them track how you're doing. All this information guides every single decision, which means healthcare can be proactive, not just reactive. That's a huge difference.
So, to pull off this investigation, nurses have this awesome toolkit with 4 key techniques. These are the tools of the trade, the methods they use to gather all those critical clues about your health.
First up in the toolkit is inspection. And yeah, it's pretty much what it sounds like. It's all about focused observation. The nurse is using their eyes to take in everything, your general appearance, your posture, the symmetry of your body. You'd be surprised how much something as simple as your skin color or the way you're breathing can be a major first clue.
Okay, next we've got palpation. This is all about the power of touch. By using their hands, nurses can feel for stuff you just can't see on the surface. We're talking about skin texture, temperature, any spots that are tender, or how strong your pulse is. It adds a whole other layer of information on top of that first visual look.
All right, number 3 is a technique called percussion. Now, this one might look a little weird, but it's actually genius. A nurse taps on different parts of your body to figure out what's going on with the organs and tissues underneath, all based on the sound it makes. Seriously, think about tapping a watermelon to see if it's ripe. The sound tells you if what's inside is solid or full of liquid or air. It's the exact same idea.
And finally, the 4th technique is auscultation. Yep, this is where the stethoscope comes out. The nurse is literally listening in on the internal story your body is telling, the rhythm of your heart, the whoosh of air in your lungs, even the gurgles in your intestines. These are sounds we just can't hear on our own, and they are packed with critical info.
Okay, so nurses have these 4 really powerful techniques in their toolkit. But here's the thing, they don't just use them randomly. The whole assessment follows a very specific roadmap. It's a systematic journey that literally goes from your head all the way down to your toes.
And this head-to-toe approach is just so smart and thorough, it makes sure nothing gets missed. It all kicks off with a general survey and your vital signs. Then it methodically moves down your body, checking out your head and neck, then your chest, lungs, and heart, then the abdomen and your musculoskeletal system, and finally, wrapping up with your neurological system and your skin. Following this path means they don't overlook anything and get a really complete picture.
And of course, happening all through this process is the constant measurement of your vital signs. We're talking temperature, pulse, breathing rate, blood pressure, oxygen levels, all those numbers. They give a critical, real-time snapshot of exactly what's going on inside your body at that very second.
So, the exam is done. The nurse has collected a ton of data. And you might be thinking, okay, so what? What's the payoff here? Well, this is the really important part. This is where all that information gets turned into actual, meaningful action. This is where data turns into doing. And you know, it's a real partnership. It all starts with the nurse preparing you, explaining what they're doing, making sure you're comfortable, and that you have privacy. And then they move on to the really critical stuff, carefully documenting every single thing they find and immediately reporting anything important to the rest of the healthcare team. And I can't stress this enough. How they write this stuff down is everything. It has to be clear, objective language. They need to note down precise measurements and descriptions. And they even include what you say, your responses and complaints. This is so important because it makes sure the entire healthcare team is on the same page, working with the same accurate info to make the best possible decisions for you. Because in the end, it all boils down to this one thing. Every single step, every technique, every little observation. It's all driving toward one ultimate goal, to catch health issues as early as humanly possible. And that improves patient safety and ultimately patient outcomes. It's a foundational process that, no exaggeration, truly saves lives.
So, the next time you find yourself at a checkup, just remember, That physical assessment is so much more than a routine. It's really a conversation with your body. It's a way for your healthcare team to listen to the stories it's telling, the ones that words sometimes can't capture. And that leaves us with a final thought to chew on. Is your healthcare team hearing the full story?